Brian Eamon with you on this Monday morning. Let's talk a little bit about the coronavirus. Hospitals obviously gearing up for patients that are expected to come in. Dr. Theodore Bailey is here, Division of Infectious Diseases. He's the chief at GBMC. Great to have you on. As always, appreciate you coming on the show. I am curious, have we learned anything new recently? What are you seeing specifically with the coronavirus?
Well, what I would say is there's a lot of clinical interest in developing therapeutics, but we're not there yet. And I think we've heard a lot of conflicting stories at this point, and we are seeing some very small studies that have suggested some benefits from some approaches, but these are very much too small to be reliable. They're more motivators for larger studies and more systematic studies. One thing I think we can take away is that a lot of initial information is not in a controlled setting. It's people doing what they can do for patients in front of them, and then reporting that out so that other people can take it up, perhaps study it in a more systematic way and find out what really does work and what just happened to coincide with people getting better.
Do we have any idea why some people are asymptomatic and others get it bad? I mean, is there any reason for that or any theories as to why that is the case?
Well, apart from the groups that we know are higher risk you're talking about, so we know that people with chronic disease and older folks are older, it may be the immune response itself. And although we treat the immune system as if it's the same thing from person to person, just like there's different hair color, different heights, we're all various individuals, the immune system also has a lot of variations, and we're trying to understand what response might be beneficial and what response might actually make things worse for a patient.
We're talking with Dr. Theodore Bailey, GBMC, Chief Division of Infectious Diseases. There's been a lot of complaints from people in the world of health that they're in desperate need of supplies, that they can't get things that they need, especially ventilators and PPEs and masks. How prepared is GBMC right now for a potential outbreak?
Well, like any hospital, our ability to handle an outbreak is dependent on how large that outbreak is at any one time. No hospital has infinite resources. We have a certain amount of ICU beds and a certain amount of ventilators and a certain amount of capacity even to add ventilators if they were to become available on the market. So there is a limit to our ability, just as there is for any hospital. And that's one of the reasons why it's imperative to take the measures that we're doing at the statewide level and, frankly, at the national and I would even say world level of trying to keep people socially distanced so that we don't see those large spikes all at one time where we would simply be overwhelmed and not have resources available for patients who would desperately need them.
Are you looking right now, though, for more PPEs and masks and ventilators?
Yeah, so we know that we need more masks going forward. We've not run through our supply, but the thing is, you build the ark before the flood. So we can forecast that if there were a large surge, we would not have adequate masks and protection. So we've already implemented a certain kind of rationing in terms of, which patients are we going to be using the masks on, the most high-tech masks versus a lower-tech. Reserving them right now for patients that we know have confirmed or disease and such. But we would like to be able to open that up, be able to use them more widely with all patients potentially. That's something that's not responsible right now because we'd probably be shifting our masks that we might have a few weeks down the road into just overuse right now. So we would like to see that more available, and I'm heartened by the fact that I think that's being recognized at the highest levels of government as a priority. We don't have plans right now at an individual hospital level to increase ventilators, but one of the things you might have noticed in the news is that there's been moves in certain areas of the country to create new spaces. You've had Army Corps of Engineers come in some places to try to build these spaces where there could be more ventilators. So I think it would be more at the Maryland or at the Baltimore level that there would be an increase of ventilators. It wouldn't necessarily be at each and every hospital.
Right. Is there cooperation among the hospitals? I mean, I know, technically you guys are kind of competitors and things like that, but I mean, are you guys working together, the hospitals in Baltimore, maybe even in the state, to kind of work through this?
Well, we certainly are, listening in on each other's plans. We're sharing game plans in a sense. In terms of cooperation beyond just common planning, that's not existing because our healthcare system is separated. We have our own medical records, we have our own facilities and such. So that's not, we're not going to be seeing, for instance, doctors going, I think, across to other hospitals to work or that kind of thing. But I think in terms of coordinating where patients go, ultimately where the best available resources are, that would be part of the plan. So, and that's true even before coronavirus. For instance, there's capabilities that we don't have for certain kinds of surgical services that other hospitals in town wouldn't. And if we get a patient that needs that, we would transfer that patient. So that's already an existing framework.
Very good. I guess the last question before I let you go. A lot of people are looking for hope. I mean, what do you see out there that is optimistic?
Well, what I see really is this unprecedented level of social distancing, that we have pulled ourselves back, and I think that's a necessary step. We know that this is contagious and a dangerous infection, and people really have bought into this. They've seen everyone else buying into it and have pulled themselves back, and that's really the most important thing at this time.
Very good. Doctor, always a pleasure to have you on. Thanks very much for your time. I know you're very busy.
Of course.
Theodore Bailey, Doctor, Chief, Division of Infectious Diseases at GBMC.